Welcome everyone. I am Fleur Bickford, International Board Certified Lactation Consultant and Program Director for Gold Conferences International. I'm here today talking with Nancy Mohrbacher, International Board Certified Lactation Consultant and Fellow of the International Lactation Consultant Association. She's going to be talking with us during our alumni presentations about breast, bottle, and childhood obesity. Welcome, Nancy.
Thank you, Fleur. It's a pleasure to be here.
Thank you. So, just wanting to talk a little bit about your upcoming presentation. So I have a few questions for you. And the first one I have is just wondering, why do you think it's important for healthcare professionals to be educated about childhood obesity?
Well, I think probably the most important reason is because there are actually recommendations that we can make to families that can make a big difference in terms of children's weight, whether it's in the normal range or whether the child is overweight or obese. And so, just strictly from a public health standpoint, I think it's important. But also for breastfeeding supporters, it's also important because in many cases, grant monies these days are very closely tied to obesity because of the obesity epidemic that's occurring worldwide. So being able to support breastfeeding more fully and be better funded, is often very closely tied to the issue of obesity. And there's been quite a bit of controversy about it. So I hope to clarify some of the controversy and give the breastfeeding supporters what they need in order to understand the issue more fully.
Okay, wonderful. Thank you. It's a really interesting point about the grant money. Not something I've really thought of before, but definitely an interesting point and very true that, that sort of stuff is often closely linked. And, talking about sort of grant money and research and stuff, one question I have for you is there any research about feeding method? We know that, breastfeeding is beneficial in terms of preventing childhood obesity, but is there any research these days about whether there's any difference between breastfeeding, directly at breast or breast milk in a bottle? Do we know yet whether it's actually the breastfeeding or is it the breast milk that's beneficial?
Well, I'm really glad you asked that because to me that's one of the most exciting parts of the presentation. We actually now are starting to understand some of the differences in the influences, for example, of whether a baby's at breast or taking mother's milk from the bottle. Also, the differences in the feeding methods themselves, and also the ingredients of the milk between infant formula and human milk. And I'm going to cover all of those three areas in my talk. And I'm very excited to share some of what we know. And obviously there's always more to learn, but we are at least at a starting point with that issue.
Wonderful. Thank you, Nancy. That sounds fascinating. And I know I'm certainly looking forward to your presentation because I know it's a really, it's an area where the research is really growing and we're constantly getting new research. So it's really exciting to be able to have you present on this for us. The last question I have for you is just, what do you hope healthcare professionals will take away from your presentation?
Thank you, Fleur. One of the things I hope they will take away is understanding more clearly the influence of breastfeeding and human milk on childhood obesity so that they can translate that into changes in practice and also into better ways to promote breastfeeding to the general public. So both practice related and promotion related.
Wonderful. Well, thank you very much, Nancy. We are really looking forward to your presentation. To our delegates, we look forward to having you join us for our alumni presentations on January 26th.
Well, thank you. I'm looking forward to it as well.